Hey everyone, welcome back to Smart Careway. I am Samuel Awowo. In our last episode, we talked about what makes a hospital smart. So we looked at how AI sensors, patient records, medical devices, and hospital staff can come together as one connected system. But today we'll be tackling the billion-dollar bottleneck engineering question. So think about it. A physical building is built to last around 50 to 80 years, right? But artificial intelligence is changing every few weeks, in fact, days, at least maybe around 50 days. So how do you design a physical building made of concrete, steel, walls, doors, corridors to work with the technology that moves so fast? That is a real engineering challenge. And the answer is not just adding computers or hanging more screens on the wall, right? The answer is something we call spatial sync. Now, what is this spatial sync? Spatial sync is a technology that allows multiple devices to understand and share the same physical space in real time. Now, for simpler understanding, think about it as giving different gadgets, all right, the same sense of where things are in a room. That's exactly what spatial sync means. This means engineers will definitely have to rewrite the rules of architecture because a smart hospital of the future is not just built from bricks, right? It is built with data. Now, this is the simple fact. So let's start with the bones of the hospital. First, we'll talk about the layout. Now, in a traditional hospital, architects usually design spaces based on expected number of patients, department needs, safety codes, and staff movements. And of course, all these are very, very important, right? But you see, health care is always not predictable. There is no such thing as an average day in a hospital. For instance, one day the emergency department is calm, and the other day it is full. 1 hour the ward is quiet, the next hour nurses are moving non-stop between patient, medication room, diagnosis area, and even the doctor's station. So instead of designing only from assumption, hospital planning can use data. This is where AI-supported generative design comes in. All right? So imagine feeding a design system with informations like patient workflow, nurses movement, emergency routes, elevator use, waiting time, and equipment location, right? The system can then test different layouts digitally before the hospital is even built. It can ask questions like, where should the nursing station be placed so that nurses work less? Which corridor reduces patient transfer time? Where should emergency elevator be located? How can we design the wards so that doctors, nurses, patients, and equipment can move more efficiently? This matters because bad design wastes a lot of time. In a hospital, time is not just convenience, time is actually care. If a nurse works less, that nurse has more time for patients, right? If a patient is transferred faster, treatment starts earlier. If equipment is easy to locate, staff stress automatically is reduced. So, in a smart hospital, what this means is that AI is not only used after the building is completed. AI can help shape the building before the foundation is even poured. That is the first level of spatial sync. Now, let's say the hospital has been built. The next question is, how does the physical building communicate with the digital system? That's a very huge question, so you think about it. This is where we meet one of the most powerful ideas of smart design, called the digital twin. So let us talk about the digital twin technology, all right? A digital twin in this case is a virtual copy of the real hospital. Now, it is not just for decoration. It is actually a living digital model that can mirror what is happening in the building in real time. You know, it sees every bed, every room, every medical device, every elevator, every operating theater, every patient's movement, every sensor, all this information is fed into the digital twin. So instead of the hospital managers guessing what is happening, they can see the hospital as a live system. Now, let me explain a scenario, or let me paint out a scenario, right? Imagine an emergency trauma patient is arriving in an ambulance or an helicopter, for instance. Now, before the patient even reaches the operating room, the hospital system can start preparing in advance. The digital twin can help identify the faster routes. It can check which elevator is available. It can even alert the trauma team. It can prepare the operating room. It can update the clinical dashboard. It can even help manage ventilation, room readiness, equipment availability. This does not mean the building is making medical decisions by itself. It's simply helping remove delays. This means the hospital is no longer standing there just like a container. It's an active assistant to the medical team. Once the hospital has a digital twin, the physical space becomes very, very intelligent. You can test patient flow, you can predict congestion, you can monitor equipment, you can improve emergency, you can even plan maintenance before something breaks. That is Spatial Sync in action. But here is something very important. A smart hospital should not feel like a sci-fi control room. Nobody wants to recover in a space that feels cold, robotic, and overloaded with machines. The best smart technology is often the technology you do not notice. This is why future smart hospital design is not just about adding more screens, everywhere. It's about making technology invincible, calm, and supportive. This is very, very important. For example, instead of loud machines constantly beeping beside the patient, smart systems can reduce unnecessary alarms like, sending important alerts directly to the staff. Instead of attaching, too many wireless devices to the patients, some hospitals are actually exploring contactless sensors that can monitor breathing and movement from a distance, or instead of waiting for someone to discover that a patient has fallen in the bathroom. There are sensors that can help detect unusual movements and alert staff quickly, so you can see that even the walls, lighting, sound, air system matters. A smart room can adjust lighting to support sleep. Acoustic design can reduce hospital noise. Air system can support infection control. Smart doors, can, guide movements during emergencies. So the architecture becomes more than a shelter. It quietly watches, it supports, it alerts, it adapts, and more importantly, it helps patients heal without making them feel surrounded by machines. This is the beauty of invincible technology. So, what is the big idea? Designing a smart hospital is not just about technology. It's about an alignment, all right? The architecture must align with artificial intelligence. Medical device must align with clinical workflow. Patient room must align with comfort and safety. Because when all of these things are disconnected, the hospital becomes very slow. But when they are synchronized, right, it becomes very, very intelligent. And here's an important fact you should not forget. Smart hospitals is not about replacing human care with machines, right? It's about giving healthcare workers more time to be human. That is the real future of healthcare. Technology must be aligned with empathy. This is how we engineer the healthcare future together. My name is Samuel Awowo, and it's a pleasure coming your way once again in this podcast, Smart Care Way. Please don't forget to like, share, and subscribe